Hello everyone, welcome to 5 Mark Short Note series. In this video, we will discuss about infants of diabetic mother. So who do we call infant of diabetic mother? Infant of diabetic mother refers to babies born to a mother with diabetes that could be either type 1, type 2 or gestational. Maternal hyperglycemia leads to fetal hyperglycemia, and in turn, this fetal hyperglycemia leads to hyperinsulinemia, resulting in metabolic and structural complications. These infants are at risk of hypoglycemia, macrosomia, and congenital anomalies at birth. So, what is the pathophysiology? Maternal hyperglycemia leads to fetal hyperglycemia. This in turn leads to fetal hyperinsulinemia. Now, this insulin acts as a growth hormone, and this will result in macrosomia and organomegaly. So after birth, maternal glucose stops, but there will be persistently high levels of insulin, resulting in hypoglycemia. And the hyperinsulinemia also delays surfactant synthesis and contributes to respiratory distress. So what are all the clinical features that are physical in nature? So the baby will be big baby, that is chubby plethoric baby with more than 4 kg, which we call it as macrosomia. There will be organomegaly of liver, heart, and adrenal gland. Birth injuries will be persistent because of shoulder dystocia and brachial plexus palsy. Then plethoric skin due to polycythemia. Large shoulders and Cushingoid face appearance will also be present. Coming to the metabolic and cardiac clinical features. So there will be hypoglycemia in the first 1 to 2 hours of the birth. Hypocalcemia and hypomagnesemia will be there due to parathyroid immaturity. Polycythemia and hyperbilirubinemia will be there. Respiratory distress syndrome due to delayed surfactant maturation because of hyperinsulinemia. Hypertrophic cardiomyopathy will be there. There will be septal hypertrophic heart failure. Congenital anomalies like cardiac anomalies, neural tube anomalies, caudal regression syndrome will also be present. Coming to the investigation, blood glucose has to be checked immediately after birth and repeat every 2 to 4 hourly. Serum calcium and magnesium should be detected and checked for whether there is any hypocalcemia or hypomagnesemia. Hematocrit access for polycythemia. Echocardiography to rule out cardiomyopathy or congenital heart disease. Serum bilirubin has to be monitored for any jaundice. Coming to the management, prevent hypoglycemia by early feeding within 30 minutes of birth. If unable to feed, 10% dextrose IV at 6 to 8 milligram per kg per minute has to be started. Maintenance of glucose has to be at least greater than or equal to 45 milligram per deciliter. Treatment of hypoglycemia with 10% calcium gluconate in 2 ml per kg IV solution slowly. Management of polycythemia by partial exchange transfusion where there is greater than 65% hematocrit. Provide oxygen or ventilation for respiratory distress syndrome. Monitor for cardiac failure. Coming to the prevention strategies, achieve strict maternal glucose control will result in maternal euglycemia, wherein there will be no fetal hyperglycemia, so there will be no hyperinsulinemia in the fetus. So this will be a good preventive strategy before and during pregnancy. Regular antenatal checkups and fetal monitoring is essential in case of gestational or type 1 or type 2 diabetes mellitus. Plan delivery in a center with facilities of neonatal intensive care and screen for any fetal anomalies with ultrasound and echocardiography. Prognosis is excellent if detected early and managed properly. Poor outcomes might lead to congenital malformations or severe cardiomyopathy, increased long-term risk for obesity, type 2 diabetes mellitus, and metabolic syndrome in later life. So the take-home message is infant of diabetic mother, there will be fetal hyperinsulinemia, which will result in problems like hypoglycemia, macrosomia, RDS, polycythemia, cardiac defects. Early feeding and glucose monitoring are crucial. Prevention through strict maternal glycemic control ensures better outcomes. Hope you learned through this video. Thank you for watching.